Welcome to the Deep Dive. Today we're tackling a topic most of us are, well, pretty familiar with. Dental caries, tooth decay.
Right.
But we're not just looking at the human side of things. We're going to explore what our sources say. And there are some surprising twists, especially when it comes to our pets.
Exactly. We've got some material here to really dig into what dental caries is all about.
Okay.
At its heart, it's really the breakdown of the hard stuff in teeth. You know, the enamel, cementum, dentin.
Main structures.
Yeah. And the culprits, basically bacteria in the mouth that just love feeding on carbohydrates left behind.
Okay, let's talk about the word caries itself. Latin, right? Means rottenness.
That's it. Paints a picture, doesn't it?
It really does. And it's funny, it's singular and plural. One cavity, multiple cavities, still caries.
One caries, many caries.
So this whole process, it sounds almost like, I don't know, a tiny food fight going wrong in your mouth.
Yeah, you could kind of think of it that way. When you eat carbs, sugars especially, those bacteria on your teeth, they start fermenting them, like basically eating the sugars.
Okay.
And the byproduct is acid.
Acid. And that's where the trouble starts.
That's the key. These acids start dissolving the minerals right out of the tooth enamel. That's called demineralization.
So weakening the surface.
Precisely. And if that acid attack keeps happening, the tooth structure gets weak enough that, well, bacteria and even the body's own cells can then break down the protein part, the organic framework of the tooth.
Wow, okay, so it's like this slow, microscopic erosion process. Now, thinking about humans, this used to be, like, incredibly common, right? Especially with diets changing.
Oh, absolutely. In westernized societies, especially with diets heavy in refined carbohydrates, caries was a huge public health problem, a really big deal.
But things have gotten better.
Definitely. Thanks to, better education on oral hygiene, preventative stuff like fluoride, we've seen a really significant drop in recent decades.
That's good news.
And in humans, there's one particular bacterium, Streptococcus mutans.
Simiensis, yeah.
That one's a key player in really kicking off the whole decay process.
Okay, so that's the human picture. But here's where our sources get really interesting, I think. There's a surprising difference with domestic dogs.
Right.
We're fighting cavities, but dogs, apparently they don't get them nearly as often. Why is that? What's going on there?
Yeah, that's a fascinating point, and the sources give us a few reasons. First off, their diet, generally lower in those easily fermentable, refined carbs that fuel the bacteria.
Makes sense.
They also tend to have a higher salivary pH, more alkaline.
Okay, so less acidic environment to start with.
Exactly, helps neutralize those acids. Plus, they have less salivary amylase, that's the enzyme that breaks down starches right in the mouth.
So less sugar available right away.
Yep. And then there's the shape of their teeth, more pointed, conical, and the spacing between their teeth is usually wider.
So harder for food to get trapped.
Much harder. And finally, just the actual mix of bacteria, the oral flora, it's different from ours.
Wow, it's like a whole combination of protective things going on, built-in defenses almost.
Pretty much, yeah.
But the source also throws in a little curveball. It says caries does still happen in dogs. It's not zero.
Exactly, not
Okay.
zero. There was a study back in 1998 in the Journal of Veterinary Dentistry. It found about 5.3% of dogs, ones over a year old, had at least one caries lesion.
5%. That's not insignificant.
No, it's not. And what's also interesting from that study, in over half of those dogs, the lesions were symmetrical, same spot on both sides of the mouth.
Huh. Bilateral. What does that suggest?
Well, it hints that maybe there's some underlying factor, perhaps dietary or even systemic, influencing where these develop, not just random chance.
Interesting. So when dogs do get caries, can it show up in different places, like in humans? Crown, root.
Yes, absolutely. In dogs, it can hit the crown, the part you see, or the roots below the gum line.
Okay.
And they classify them based on location. You've got pit and fissure caries.
In the grooves.
Yeah, exactly. In those natural grooves on the chewing surfaces. Then there's smooth surface caries on the flatter sides. And finally, root caries affecting, well, the root surfaces.
Got it. Now, something else the source brings up, which I think might confuse people, is this term feline caries. It makes it sound like cats get the same kind of cavities, right?
Yes, this is a really important point to clarify. What people often call feline caries isn't actually caries at all.
Oh, what is it then?
It's a totally different process. It's called tooth resorption, or more formally, feline odontoclastic resorptive lesions, FORLs.
Odontoclastic.
Mm.
So the cat's own cells are breaking down the tooth.
Exactly. It's the cat's body resorbing the tooth structure. It's not that bacteria-driven decay process we see in true caries.
Wow.
The source actually points out that, as far as the author knew, there weren't any published reports of true dental caries in domestic cats. Though, theoretically, maybe it could happen under just the right circumstances.
But generally what we see in cats, that looks like a cavity near the gum line, that's usually resorption.
That's usually resorption, a completely different mechanism.
Good to know. Okay, back to dogs then. Are certain breeds or ages, or maybe males versus females, more likely to get actual caries?
Interestingly, the source says that overall there isn't a strong reported link, no specific breed, age, or sex predisposition across the board. But there is an anecdotal observation mentioned about those pit and fissure lesions, the ones in the chewing grooves. They seem to be seen more often on the upper first molar teeth in some large breeds.
Which ones?
Like Labrador Retrievers and German Shepherds are mentioned specifically.
Okay, so maybe something about the anatomy of those molars in those bigger dogs.
Could be. It's not definitive proof, but it's something vets might keep an eye out for in those breeds, a potential heads up.
Right, a useful little clinical note. Now, the source also breaks down the stages of caries in dogs, like how bad it is.
Yeah, there's a table 1 that lays out 5 stages. Stage 1 is just starting only in the enamel or the cementum, the root covering. Very superficial.
Okay, early days.
Stage 2, it's gone into the dentin, the main tooth structure, but not into the pulp yet, the nerve center.
Still contained.
Stage 3, it has reached the pulp cavity.
Yeah.
So there's deeper tissue loss, pulp exposure, but the tooth still mostly has its shape.
Good serious.
Stage 4, now we're talking significant loss of tooth structure. The tooth's integrity is really compromised.
Wow.
And stage 5 is the most severe. Most of the crown is just gone. You might only have root remnants left.
Wow, that really paints a picture of how destructive it can be if it's left untreated. So what are the warning signs? What should someone look for if they suspect their dog might be developing caries?
Well, in the very, very early stages, what's called incipient smooth surface caries, you might, if you look closely, see a sort of dull, frosty white spot on the enamel.
Subtle.
Very subtle. Once it progresses to clinical caries, meaning there's actual structural damage, you'll often see a visible defect, like a hole or a rough spot on the crown, or maybe even the root if the gums have receded. And this area often looks dark, and it's filled with this soft, almost mushy material.
Mushy? What is that?
That's the necrotic dentin, dead, decaying tooth structure. And these defects can also trap food particles, making things worse.
Right. You mentioned soft dentin. That sounds really different from healthy tooth structure. How does a vet actually tell the difference during an exam?
That feel, that tactile difference is crucial. The source really emphasizes this. Affected, carious dentin will feel soft. It actually gives way if you gently press on it with a sharp dental explorer tool.
The pointy instrument.
Exactly. It might even feel a bit sticky where the tip might catch. And you can often easily remove some of that softened dead material because it's just not sound tooth anymore.
Okay, that really clarifies the what of dental caries, especially in dogs. It's definitely more complex than just a simple cavity. So now we know what it is. Let's dig into the why. What causes it, and what are those risk factors that make it more likely?
Okay, so the fundamental cause, like we touched on, is that whole process. Bacteria in the mouth fermenting carbohydrates.
Right, the acid production.
Yep, producing acids. Those acids then demineralize the hard tissues, enamel, cementum, dentin. They leach out the mineral.
Step 1.
Step 1. And then, following that mineral loss, bacteria and even the body's own immune cells sort of digest or break down the organic part, the protein matrix of the tooth.
So it's that double whammy again, weaken the structure, then break down the material itself.
Exactly. And there's actually this constant back and forth happening in the mouth.
What do you mean?
Well, there's a continuous exchange of minerals between the tooth surfaces and the oral fluids, like saliva. Minerals coming off, minerals going back on.
Okay, a dynamic process.
Very dynamic. Caries develops when the balance tips, when there's a net loss of minerals over time.
Oh.
In the very early stages, that demineralization can actually be reversed. Saliva can help put minerals back remineralization.
So there's a chance to recover.
Initially, yes, but once that protein framework of the tooth collapses because too much mineral is lost and the bacteria get in, then the damage becomes irreversible. You can't just remineralize a hole.
That really highlights why catching it early is so important. So what things tip that balance towards mineral loss and irreversible damage? What are the big risk factors?
Well, Anything that lets carbs and that sticky bacterial film, plaque, hang around on the teeth for a long time, that's a major one.
Makes sense. Prolonged contact.
Right. The source specifically calls out those deep pits and fissures on the chewing surfaces.
Especially those upper first molars in big dogs we mentioned.
Exactly. Those are prime spots for decay to start. Also, if a tooth already has some caries, the surfaces right next to that decayed area are at higher risk too.
Like it spreads.
Or
Or creates a favorable environment.
more like it creates a favorable environment, yeah. Other risk factors include any naturally deep grooves on teeth, tight spots between teeth where plaque hides.
Hard to clean areas.
Yep. Deep periodontal pockets, those gaps between tooth and gum are bacteria traps.
Hmm.
And the quality of the enamel itself matters. If it didn't mineralize properly when the tooth formed, it's weaker.
Okay. What about saliva?
Low salivary pH, more acidic saliva, is a risk factor. A diet that's consistently high in fermentable carbs, obviously. Poor oral hygiene, of course.
Naturally.
And finally, anything that causes loss of the protective enamel layer where trauma, developmental issues, exposes the softer dentin underneath, which decays much more easily.
Wow, that's quite a list. It really shows how lots of different things can contribute. Now, if a vet suspects caries in a dog, what else might be going on? What conditions look similar, the differential diagnoses?
Good question. The source lists a few things that can sometimes mimic caries. A simple tooth fracture, for instance?
Broken tooth.
Yeah. Just normal wear and tear, attrition that exposes the underlying dentin can sometimes get stained and look like decay.
Okay.
And enamel hypocalcification where the enamel didn't form right, leaving it maybe pitted or discolored.
And we have to remember the cats. Or rather, the thing that looks like caries in cats but isn't.
Absolutely. Tooth resorption, those FORLs we discussed, were historically mistaken for caries. And they can happen in dogs too, though less commonly than in cats, so that needs to be ruled out.
And how do they tell the difference? You mentioned the feel earlier.
That tactile feedback is often key, according to the source. Healthy, sound dentin feels hard when you touch it with that explorer. Carious dentin feels soft, it yields, it might be sticky.
Hard versus soft. That seems pretty definitive. What about decay on the roots? Root caries. Could that be confused with something else below the gum line?
Yeah, root caries can sometimes be tricky to distinguish from something called external root resorption, which is another process where the root structure gets eaten away.
Okay.
But the source points out that, honestly, telling them apart is often kind of academic from a treatment standpoint,
Why is that?
because for both conditions, especially if they're advanced, the most likely treatment is going to be extracting the tooth anyway.
Okay. So the end result is often the same. We've covered the lookalikes. How does a vet actually diagnose caries? What's the process?
It typically starts with a really thorough visual exam, looking at every tooth surface. And this works best when the teeth are clean, dry, under good light, and ideally with some magnification.
Getting a good look.
Then comes the probing. Using that sharp dental explorer, like we said, if it sticks, catches, or feels soft, that's a strong indicator of caries. Gives you that tug-back feeling sometimes. And for checking below the gums, careful probing with special instruments helps find irregularities on the root surfaces that might be root caries.
What about those dyes? You sometimes hear about caries detection dyes in human dentistry. Are they used for dogs?
The source mentions them, yeah. They've been used in both fields to try and stain the decayed dentin.
Do they work?
Well, the source adds a note of caution. They can sometimes give false positives, stain healthy areas, leading to maybe removing too much sound tooth structure.
Overtreatment, right.
Exactly. So the current thinking leans more towards relying on that careful visual exam, the tactile feel with the explorer, and crucially, x-rays.
Radiographs, of course. How important are they?
Extremely important. Intraoral dental x-rays are critical. Areas where minerals have been lost due to caries show up as darker spots, more radiolucent compared to healthy tooth.
So you can see the damage inside.
Yes. And if the decay has reached the pulp, the x-rays might show signs of trouble inside the tooth, endodontic disease, or even infection around the root tip in chronic cases.
But are they perfect?
Not always. The source does note that very small, early lesions, especially on the crown, can sometimes be hard to spot on x-rays because of all the overlapping structures.
So it sounds like the best diagnosis comes from putting it all together. The visual check, the feeling with the explorer, and the x-ray picture.
That's exactly right. Combining all those findings gives the most accurate picture.
Okay, let's shift to treatment. Caries is diagnosed in a dog. What happens next? What are the options?
Well, the source really stresses prevention first whenever possible.
Makes sense.
It suggests vets should check young adult dogs, maybe around 6 to 8 months old, specifically looking for those high-risk spots like deep pits and fissures on those upper first molars.
Be proactive.
Right. If you find those spots before decay starts, you can apply things like pit and fissure sealants or fluoride-releasing bonding agents to protect them. Create a barrier.
Like sealing paving stones before they crack?
Kinda, yeah. A proactive defense. But what if caries is already there?
Yeah, what
The
that is.
really early incipient caries just starting maybe a topical fluoride treatment or a bonding agent to try and encourage remineralization, plus addressing the risk factors like diet.
Okay.
If there's actual loss of tooth structure, mild to moderate, like stages 1 or 2,
Mm-hmm.
the standard approach is to carefully remove all the soft, decayed dentin and any weak, unsupported enamel around it. Clean it all out.
Using dental drills.
Yes, specialized dental burrs and instruments. Once it's clean and sound, you restore the tooth's shape and function, usually with a bonded composite resin filling. Sometimes, if it's extensive, maybe a crown.
And what if it's deeper? Stage 3, reaching the pulp. That sounds more involved.
It is. If the pulp is exposed or infected because of the decay, then you're usually looking at root canal treatment endodontics to save the tooth.
Explain that briefly.
Sure. It involves removing the infected pulp tissue from inside the tooth and root canals, cleaning and shaping those canals, and then filling them with a sterile material to seal it off.
And after that?
After a root canal, the tooth is weaker, so it typically needs a protective crown placed over it. Now, if root canal isn't feasible or the owner declines,
Then what?
then extraction, pulling the tooth, is the alternative. And if you extract a tooth with pulp involvement, you must get all the root pieces out to prevent ongoing infection.
Right, clean removal. What about those really advanced stages, 4 and 5, where the tooth is mostly gone?
In those severe cases, extraction is pretty much the only practical option. Again, making sure to remove all root fragments is critical because the pulp is definitely infected by then.
And root caries. Decay below the gum line.
That's often tricky. If the gum disease around it can be managed, and if you can actually place a filling that seals properly above the gum line, maybe restoration is possible.
But often.
But often, because of the location and difficulty in getting a good, long-lasting seal, extraction is the most predictable choice for root caries.
Okay.
Although, for teeth with multiple roots, if only one root is bad, sometimes they can do a root resection, just remove the bad root and do a root canal on the rest of the tooth.
Wow, complex options.
Yeah.
It really sounds like the treatment has to be tailored to the exact situation of each tooth.
Absolutely. Stage, location, overall health of the mouth, it all plays a part.
Are medications usually involved? Antibiotics, pain relief?
Sometimes. The source mentions maybe using broad-spectrum antibiotics after procedures involving the pulp, like root canals or extractions, especially if there was infection.
Makes sense.
And pain management is definitely important after those bigger procedures.
Yeah.
Usually NSAIDs, non-steroidal anti-inflammatories, maybe short-term narcotics for more significant pain.
So, handling infection risk and discomfort. What about long-term? What kind of follow-up is needed after caries treatment?
Regular checkups are really crucial. The recommendation is usually a recheck exam with new x-rays of the treated teeth about 6 months later,
6 months.
and then annually after that, or sooner if needed. At these visits, the vet checks if the fillings are holding up, looks for any new decay around the edges, and makes sure no secondary problems like infection inside the tooth are developing.
And checking all the teeth.
Oh, definitely. It's essential to check every tooth visually and with x-rays because if a dog gets caries in one tooth, they're often at higher risk for more elsewhere.
Good point. A whole mouth approach.
Uh,
So let's bring this back to the listeners, the dog owners out there. What's the key takeaway for prevention from our source?
The main piece of practical advice is really about diet. Avoid feeding diets and treats that are loaded with refined carbohydrates and sugars.
Cut down on the fuel for the bacteria.
Exactly. Limit the fermentable stuff they need to make those harmful acids.
Simple, but important. And if caries is found and treated properly, what's the outlook, the prognosis?
Generally, it's excellent. If the decayed tissue is completely removed and the tooth is restored correctly using sound dental techniques, the long-term prognosis is very good.
So proper diagnosis, proper staging, careful removal, good restoration.
Yes, all those steps are critical for success.
That's really reassuring. With the right care, it's a manageable condition.
Yeah.
Okay, as we wrap up this deep dive on dental caries, what's a final thought you want to leave our listeners with? Something to chew on, so to speak.
Well, maybe think about this connection we've discussed: diet, bacteria, body tissues, and how central it is to caries. Could this kind of interplay offer clues about other health issues?
Hmm.
Are there other problems in humans or animals that seem localized but might actually have broader, maybe systemic roots tied into things like diet or the microbiome that we need to understand better?
That's a fascinating question, the interconnectedness of it all. Definitely something to ponder. Thanks so much for digging into this with me today. My pleasure.
And thank you for joining us on the deep dive. Until next time.